I want to start by saying if you have been told that you have or had a chemical pregnancy, I am so sorry. I know pregnancy loss is devastating. I had a miscarriage, and it is an unimaginable type of pain that no one can understand unless they actually go through it. And so chemical pregnancy, it can sound a lot like clinical pregnancy. A clinical pregnancy essentially means that you're having a healthy, normal pregnancy. A chemical pregnancy means that the pregnancy is not going to continue developing. And this is a loss that happens before the 5th week of gestation. And in this type of pregnancy, an embryo forms and sometimes implants in the uterus, but then it stops developing. And sometimes somebody that isn't actively trying to become pregnant might not even know that they were pregnant with a chemical pregnancy because it ends so quickly, and often they mistake the bleeding from the chemical pregnancy for their period. If you have been trying to get pregnant, you probably took that pregnancy test like as soon as you were able, and because a lot of times HCG is created during a chemical pregnancy, after that embryo implants, you get that positive pregnancy test, but then it goes away. And a chemical pregnancy is called this because as I just said, it develops enough for the hormone HCG to develop. However, if you had an ultrasound, it likely wouldn't show signs of the developing fetus. And for example, you wouldn't see a heartbeat. And after the embryo stops developing, usually those HCG levels begin to fall until they're back down to 0, and you would take a negative pregnancy test. And I want to note again that just because a chemical pregnancy causes a loss so early in pregnancy, it is still a loss, and you still have every right to mourn in any way that you need to. You still had a miscarriage, and no one gets to tell you that, you don't get to be sad or it doesn't count because the fetus never had a heartbeat. And while anyone can experience a chemical pregnancy, there are things that can increase the risk. So if you are 35 or older, you have an atypically shaped uterus that might make it more difficult for the embryo to properly implant. If you have an imbalance in hormones like prolactin, thyroid hormone, or progesterone, that could lead to a chemical pregnancy. And the progesterone, it's so important in particular because it is what causes the uterine lining to thicken and prepare for the proper implantation of the embryo. If you have an STD like gonorrhea or syphilis, talk to your care provider if you have any STD, and they can let you know if that particular STD could increase the chance of a miscarriage. Not all of them do. If you have thyroid disorders, diabetes, or polycystic ovary syndrome, PCOS, that could increase the chance of an early miscarriage. And some of the most common symptoms of a chemical pregnancy include, your period coming about a week later than usual. But again, this is really the uterus shedding that embryo that is no longer developing. You take a positive pregnancy test, but then you get your period, or you have a positive pregnancy test, and then a few weeks later, that test is negative. If your period is heavier than usual and you're having more intense menstrual cramps, this could be a sign that, that egg did fertilize, that embryo did implant, but it did not continue. And another symptom could be taking a positive pregnancy test, but not really having any other symptoms of pregnancy. And with that said, plenty of healthy pregnancies do start out without many symptoms. So just because you don't have a lot of symptoms does not mean that you're going to have a pregnancy loss. Why does a chemical pregnancy happen? Unfortunately, nobody knows exactly why they happen, but it's suspected that it's due in most cases to genetic issues in the embryo or the embryo not being able to properly implant in the uterus. And while there's not really any way to prevent a chemical pregnancy, the good news is that it's not typically a sign of fertility issues, and most women go on to develop a healthy pregnancy after a chemical pregnancy. Sometimes really, really soon after the chemical pregnancy. But again, this does not mean that you shouldn't mourn if you have this kind of loss. Women also want to know, how soon can I try again after a pregnancy loss? Most women ovulate about 2 weeks after a chemical pregnancy is past, meaning that you could potentially conceive a healthy baby 2 weeks after, again, that heavier than usual menstrual cycle that again is, actually the embryo being shed from the uterus. And, you also, your body is not going to typically develop a new pregnancy if there's still HCG lingering in the body, because that's essentially giving the body the sign that you are still pregnant. So typically you're not going to be able to conceive again until you confirm there's no more HCG in your body by taking a pregnancy test and getting a negative. It's one of the only times when you're trying to get pregnant that a negative test is actually encouraging. But again, a lot of women can get pregnant just 2 weeks after. Okay, and even though a chemical pregnancy isn't typically a sign of a fertility issue, if you are concerned about that, there are some key questions that you can ask your care provider. So you can ask, when should I see a fertility specialist? How long should I wait? If I have, say, a few chemical pregnancies, should I go see a fertility specialist then? So that's a good question. Is there anything I can do to increase my chances of developing a healthy pregnancy? I'm about to post a video on that, but it's also great to talk to your care provider about that. And are there any tests that you would recommend to see if there's some underlying issue that could affect my ability to become pregnant or maintain a healthy pregnancy? And again, if you know that you had a chemical pregnancy, if you suspect that you're having one, I'm sending you so much love. I'm so sorry. If you want, additional support for navigating these emotions, let me know in the comments below.